So in this audio lecture, we're going to be moving into renal failure, and so these are going to be disorders that impact renal function, obviously. And so we have acute renal failure, which is also known as acute renal injury, and then we have chronic kidney disease, which is a more prolonged form of this renal failure. So this disorder is classified as inability for the kidneys to maintain function and can either be acute and or chronic. So what is acute renal failure? Acute renal failure is the sudden loss of renal function. Now this acute renal failure has the characteristic that it is reversible. Okay? So depending on the severity of the condition, it has a 10 to 60% mortality rate, depending on the cause that it has. So, first of all, who's at risk for developing acute renal failure? Critically ill, hospitalized patients. And so we see that this disorder can be based on three categories. All right, so we have three different categories that cause this acute renal failure. The first one is going to be pre-renal conditions, and this is going to be due to a disruption in blood flow. And so really anything that causes a reduction in blood pressure results in a reduction in the driving filtration pressure. Okay? So things like shock and dehydration so shock is this systemic vasodilation, where dehydration is going to be reduction in blood volume. Okay? If you don't have the driving force to drive the blood into the kidneys, then you can't filter the blood. And so we could also see that this low blood pressure could be due to heart failure, okay, or a myocardial infarction. Okay? And these can disrupt really the initial pressure that we're able to generate. So really in these conditions, we would want to increase blood pressure to correct it. For the intrarenal etiology, we find that kidney damage is the result. So first of all, any kind of reduction in blood flow can reduce reduction in blood flow within the kidneys can reduce kidney function, right? And so atherosclerosis, hardening of the arteries, like so that we see in like poor diets or smoking, we could see can decrease this. Okay. Hemolytic uremia syndrome can be the result of a bacterial infection, and really this is the leading cause of acute renal failure in children. And then we could have renal inflammation, and this could be due to an autoimmune disorder, okay, like a systemic lupus erythematosus or rheumatoid arthritis. Okay. Now, finally, we have toxic injury, and so toxic injury can be due to ingesting too much of a certain substance or ingesting a toxic substance. Okay, so substances can include alcohol, cocaine, heavy metals, petroleum, gas, chemotherapy drugs. Chemotherapy drugs, remember, target all cells. They don't really care what, and they can result in damage. Now, contrast dyes, so like you see in intravenous pylorograms, can result in kidney injury as well. The last etiology is due to post-renal conditions, and so these post-renal conditions are going to lead to an interference in urinary excretion, leading to waste buildup in the kidneys. Okay. So first of all, this could start with a ureter obstruction, so something like stenosis of the ureter or a kidney stone passing into the ureter, obstructing flow of urine. If we have a condition in which the bladder emptying is compromised, then we could see that this could cause damage because this nitrogenous waste is going to build up in the kidneys if it can't effectively get out. And so some conditions that can affect the bladder emptying can be benign prostatic hyperplasia, tumors like renal cell carcinoma or Wilms tumors, and or nerve damage if we can't properly tell the bladder when to empty. Okay. Some other causes of acute renal failure include age, autoimmune disorders like we've already seen. So we've seen lupus. Um, so age really increases susceptibility of all three types, and then liver disease. So meaning we have compromised immune function. All right. So acute renal failure really progresses relatively fast, within 48 hours, and it progresses through 4 different phases. So the first phase of this is asymptomatic, and all the while it's not displaying any symptoms, damage is occurring. And so the nephrons can generally compensate during this phase so that we are maintaining normal function. So the nephron compensation leads to hypertrophy of those nephrons and not so much hyperplasia, but hypertrophy of the nephrons. So the manifestations start to appear, and when 50% of the nephrons are really impaired. So the next phase is oliguric phase, in which oliguric means that we get a decreased urine production, and so this leads to an increased BUN, or blood urea nitrogen. Okay. And really this stage can last from days up to weeks. Okay. And so we get less than 400 milliliters of urine produced per day, whereas normal is looking at 750 to 1800 milliliters, and so we see substantially compromised renal function. The next phase is called the diuretic phase, and so the diuretic phase is defined as having increased urine production. And so really we've done a lot of damage to our tubules, and now we get decreased reabsorption of water and solutes in turn. So we can see electrolyte disorders start to occur during this phase. Now, recovery phase can last between 3 and 12 months. Okay, the function can return to normal during this recovery phase if we're able to get to, and you can actually regain full renal function based on your health and age status. And so the healthier you are, the better you are able to recover from this disorder, and then the younger you are. All right. So the manifestations for acute renal failure are divided into the oliguric and the diuretic phases. And so the manifestations for the oliguric phase include decreased urine output, because now really the functional nephrons are going to be infected, and so now we see a decreased urine output. Okay. Plasma electrolyte disturbances are going to reflect a decreased filtration. And so now the plasma electrolytes are likely going to increase, so sodium, potassium, calcium, phosphates, and bicarbonate would all increase, and we'll talk about those in the electrolyte, fluid, acid-base disorder chapter. Okay. We're going to experience elevations in plasma volume and blood urea nitrogen, as well as creatinine. So remember that the increase in plasma volume results in an increase in blood pressure. Because if blood volume increases, that has a direct effect on blood pressure. So azotemia refers to this increase in blood urea nitrogen and creatinine, and that can create really a fatigue and result in toxicity. Metabolic acidosis would reflect a reduced ability to secrete hydrogen, so along the distal convoluted tubule and then the collecting duct, we see that hydrogen ions are secreted, and so if we have impaired ability to secrete those hydrogen ions, we also see that the acidosis can be generated from metabolic processes. Right? So the azotemia would be defined as a blood urea nitrogen level above 20 milligrams per deciliter. So the normal range for urea is 8 to 20 milligrams per deciliter, whereas The creatinine is 0.7 to 1.4 milligrams per deciliter. All right. The next phase is the diuretic phase, and so this leads to an increased urine output, right? So now your ability to reabsorb that water is impaired, and so we see an increase in urine output and a reduction in blood electrolyte concentration, and so you really can see any number of associated disorders, which we'll talk about more in electrolyte disorders. Okay. As a result of the increased urine output, you are going to suffer from dehydration and hypotension. So hypotension is low blood pressure because now blood volume is decreasing. How is acute renal failure going to be diagnosed? So first of all, you're going to complete a history and physical examination. You're going to be looking at a blood analysis, okay, looking at electrolyte composition, urea levels, creatinine levels, and this is going to tell you what phase in the acute renal failure you're in, whether the initial phase is not going to display because the nephrons compensate for one another, but once we start to progress through the different phases, oliguric or diuretic phases, then we're going to see the blood analysis and the urinary analysis really stand out. We're going to complete a renal ultrasound to image it and then biopsy the renal tissue. Okay. So the treatment really depends on the phase, so either oliguric or diuretic phase. And so this treatment may rely on temporary dialysis, but it's most likely going to revolve in a change in lifestyle. Right. So here you're going to have a high calorie diet and a low protein and low electrolyte diet. So low sodium, potassium, and phosphate diets. Okay. You are going to be controlling your blood pressure through pharmacological means, and then improving exercise choices. Okay. Now, erythropoietin might be decreased in production. So since erythropoietin might be decreased in production, you might require exogenous erythropoietin to account for anemia that is developed because the acute renal failure is beginning to develop. Okay. Last but not least, we are going to want to prevent infections, to prevent any kind of secondary causes here. All right, so that is the end of the acute renal failure lecture. Please stay tuned for the chronic renal disease.